All right. Good afternoon, everyone. I am Rami Lima, President and CEO of Miller-Keystone Blood Center. I would like to welcome you all to our Hamilton Donor Center here in downtown Allentown. And thank you so much for joining us to celebrate this amazing partnership and critical accomplishment. Having blood available in the ambulance is a game changer. This is going to change the way we manage our patients in the field. Having the blood readily available for first responders to be able to transfuse blood and stabilize the life of those patients that are dealing with severe bleeding, stabilize them until they get to the hospital to save their lives, is what we're talking about today. And that's what Miller-Keystone does. As a community blood center, we did partner with our hospitals a few years ago, and we made sure that this program was successfully implemented with St. Luke's, Geisinger, Tower Health, and today this group in the city of Allentown is leading the non-hospital EMS group to make sure that the blood is going to be available for patients in the city of Allentown. I cannot thank you guys enough for your partnership and for the hard work that you put behind the scene to get us to where we are today. Kudos, great job. And I just want to make one comment. We cannot make this possible without our blood donors. So I'm going to be asking all of our Allentown populations, roll up your sleeve, donate the blood, and make sure we have the blood available. And nobody can speak better than the mayor of Allentown, Matt Turk, about this, who is a blood donor himself. Mayor?
Thank you, Rami. I'll drop that just a little bit. I am a donor. I first donated here when this center opened. I think it was actually the first time that I donated. My name is Matt Turk. I'm the mayor of the city of Allentown, proud mayor of the city of Allentown. Blood donor here at Miller-Keystone. I think I'm overdue for a donation. I'm sure that if we have a minute, I'll probably be giving some, I'm sure. I think I'm successful. I'm a good blood donor too. Regular, but for all of the blood that I give, I can't give enough. I've only got so much. I try, but I can't give enough to meet all of the need in the city of Allentown. And even if we all get involved and we all give, we want everybody to give, even if we give, we still wouldn't have enough. And I think what we're about to talk about here, and Mehmet Barzev, who's our chief of EMS, is going to go into some details in a second, but I think this is an excellent example of how our city evaluates a need based on experience. We use the data. We listen to our employees who are out in the field and making observations. They get creative about the need for a solution. In this case, we just didn't have enough blood to meet the need in ambulances. Our team developed some innovative solutions, and they look for a partner to show up. And that's what we're all about in Allentown, is we show up. Our paramedics show up in case of an emergency. Our employees show up every day to meet the residents' needs of the city of Allentown. Our residents show up for each other all the time, just like we asked. We're going to ask residents to show up and donate blood, roll up their sleeves and donate blood. We also need partners to show up, and that's where Miller-Keystone is so important. When we were looking for a partner who could help us execute on this innovative approach to saving lives in Allentown, Miller-Keystone stepped up and they showed up. So I'm incredibly proud of our team, of our nonprofit partners here in Allentown, and of our residents for showing up every day to meet the needs of the residents of the city of Allentown. Our job, as our team here can tell you, is to create a safe, clean, and healthy environment in the city that promotes the well-being of our residents. Safety is the first job there. And we take that job very seriously, from our police and our fire to our EMS. We want to make sure that people are able to get ahead because we're creating a safe environment. And one way for us to do that is to make sure that we have all of the tools that we need to save lives. And that's where Allentown is a leader, and I'm grateful that we are leading because we're listening to our employees. And first among those is our incredible chief of EMS, Mehmet Barzev, who's going to talk a little bit more about some of the details behind this truly innovative approach to saving lives in the city of Allentown. Mehmet?
Good afternoon. I'm Mehmet Barzev. I'm the chief of EMS for the city of Allentown, and I'm also here with the assistant chiefs, Matthew Brett and Ryan Trexler from the Bureau of EMS. with some exciting news that is very significant in advancement for our Bureau of EMS. Today we're proud to announce the launch of the Allentown EMS Pre-Hospital Blood Program. This program aims to improve patient outcomes by providing life-saving blood products moments before patients actually reach the hospital. Rapid access to blood can significantly be the difference in life and death, particularly in trauma patients. And this initiative will help our Bureau impact those patients with both traumatic and medical emergencies effectively. Research shows that early administration of blood products can significantly impact your critically ill patients, improving their survival rates. And our data shows that out of the over 19,500 calls a year we respond to annually, about 50 of those patients per year would be candidates for blood. This program wouldn't be possible without the collaboration of the Pennsylvania Department of Health, the Miller-Keystone Blood Center, all of our area hospitals, and our dedicated EMS staff. Also, we want to mention our mentors in this program, the administration and providers of the Newcastle County, Delaware EMS paramedic service. They were influential in taking our staff on ride-alongs, helping us build this blood program from the ground up, and then seeing it through our success of Ryan and Matt of getting this implemented. As a standalone EMS agency, meaning we are not hospital-based, we had to build this program brick by brick, establish relationships with all of the area hospitals that are going to receive these patients, and then find a vendor. When we were looking for people to supply the blood product to our ambulances, bar none, Miller-Keystone was the best to work with. From inception of our plans to helping us work through our testing and our protocols, and even following along our journey of carrying around a little bag of saline for almost a year to make sure that we could keep that in temperature so that when we actually carry blood product, we weren't going to ruin it or waste it. We believe that this program will not only enhance emergency response here in Allentown, but reinforce our commitment to Allentown and beyond. We believe this will be a precursor to other agencies to follow suit, impact their communities, and improve patient outcomes. I want to thank you for being here today. I want to thank Mayor Turk and the city administration for allowing us to do what's best for our community. And we look forward to sharing more updates as the program progresses through this important initiative. At the succession of this conference, we invite all members of the media and the public outside, and Matt and Ryan will go over the equipment and showcase how we administer it. I realize it's cold, but we promise we'll be brief. It's good for the blood, it won't expire. And then, of course, we'll be here to answer any questions. I forgot who I'm supposed to be.
Me.
I'm sorry.
Okay,
Hope.
it's myself.
I apologize. And now from Miller-Keystone, Hope.
Thank you. Thank you, Annette. Thank you, everyone. I'll be brief because I'm the closer and everyone has heard. I'm going to pretty much say what everyone said, but that's okay. But I truly want to express the privilege it has been for us as Miller-Keystone to work alongside Matt and Ryan. It's been remarkable. From that first day, Matt, when you called, you asked me, can we even do this? We've hit the ground running. So standing here today and seeing our low titer whole blood out there on the Allentown EMS is something that everyone in this room should be proud of. I also want to recognize our hospital partners, as it's been previously stated. While primarily this is an EMS-driven initiative, our hospital partners have been crucial in maintaining awareness and just keeping us all connected as the initiative has progressed. So behind the scenes, there's been an incredible amount of work that's been done to get this going. From training, logistics, inventory management, and constant communication, the teamwork and dedication to get this going cannot be overstated. We also want to encourage other EMS systems to adopt a program like this. This is very crucial to have on your rigs when those critical moments and seconds count. And most importantly, as Rami said, none of this would be possible without our blood donors. To those of you who donate regularly, thank you so much. Your generosity is what keeps programs like this alive. So grab a friend, roll up a sleeve, and continue donating. We truly need you. Thank you.